Okay, so here we have the pelvis, which is made up of the two coxal bones. So we have a left hip bone and a right hip bone, and the sacrum posteriorly. So there's three main parts of a hip bone. Superiorly, it's made up of the ilium. Anteriorly, it's made up of the pubis. And posteriorly, we have the ischium, the posterior inferior aspect. So if we look at a coxal bone on its own, here we have the large wing-shaped ilium, which forms the superior aspect of the hip bone. Anteriorly, we have the pubis, which is V-shaped. And posteriorly, inferiorly, we have this larger part called the ischium. So if we start up on the ilium, the most superior border of it is called the iliac crest. When you put your hands on your hips, you're resting them on the iliac crest. If you follow the iliac crest anteriorly, it stops at the ASIS, the anterior superior iliac spine. Just inferior to it, there's another spine called the anterior inferior iliac spine. These are important attachment sites for muscles that enter into the thigh. Okay, so if we follow the iliac crest posteriorly, it ends in the posterior superior iliac spine, or the PSIS, and just below it we have the posterior inferior iliac spine. If we turn it again like this, we can see the iliac fossa, which you again can see here. It's an important site for muscle attachment. Okay, what else can I tell you? Here is this roughened surface, which is called the auricular surface, which is where the sacrum articulates with the coxal bone. Just inferior to the PIIS is this notch, this groove here. And the notch is called the greater sciatic notch. It ends here at the ischial spine. So now we're down at the ischium. Just below the ischial spine, there's another small notch called the lesser sciatic notch. Okay, if we go to the pubis, travel along here, we have the body of the pubis. If we look here where they come together, the two bodies of the pubis form the pubic symphysis joint, or articulate to form the pubic symphysis joint, with the disc in between. Just above the body, we have the superior ramus of the pubis, this thin part of bone. Just inferior to it, we have the inferior ramus of the pubis. Along the top, or the superior aspect here, there's this flat area called the pubic crest. And here we have the small little pubic tubercle. We keep going posteriorly, we enter into the part of the coxal bone which is referred to as the ischium. And the ischium has this large projection on the posterior inferior aspect called the ischial tuberosity. So when we're sitting down, we rest on the ischial tuberosity. Connecting the ischium and the pubis together is the ischial ramus. Okay, so here's this flat piece of bone, which is the ischial ramus. Here's the inferior ramus of the pubis. And together, these two bones help to form the obturator foramen, a hole, which is actually in real life covered up by a membrane. Okay, if we turn it again, where I put my hands around here, this is the ischial body, the body of the ischium, kind of where you can grip onto it. And if I turn it again laterally, you can see the large socket here, which is the acetabulum. The acetabulum is actually formed by the fusion of the ischium, the pubis, and lastly the ilium here. So it helps to form the big socket. If you look closely, you can see the lunate surface on the inside of the acetabulum here. There would be a ligament that would help to close off the lunate surface, the transverse acetabular ligament, which we talked about yesterday. Also lining along the outside of the acetabulum is the labrum, which helps to increase the depth of the acetabulum. I think that's it.
Thank you.
For most